Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
A multigravida in active labor is 7 centimeters dilated. The fetal heart rate baseline is 130 beats per minute with moderate variability. The client begins to have variable decelerations to 100 to 110 beats per minute. What should the nurse do next? 1. Perform a vaginal examination. 2. Notify the primary healthcare provider of the decelerations. 3. Reposition the client and continue to evaluate the tracing. 4. Administer oxygen via mask at 2 liters per minute. The correct answer is 3. The cause of variable decelerations is cord compression, which may be relieved by moving the client to one side or another. If the client is already on the left side, changing the client to the right side is appropriate. Performing a vaginal examination will let the nurse know how far dilated the client is, but will not relieve the cord compression. If the decelerations are not relieved by position changes, oxygen should be initiated, but the rate should be 8 to 10 liters per minute. Notifying the primary healthcare provider should occur if turning the client and administering oxygen do not relieve the decelerations. A child is admitted with a tentative diagnosis of Shigella. The nurse should do which of the following? Select all that apply. 1. Assess the child for nausea and vomiting. 2. Collect a stool specimen for white blood cells. 3. Place the child on airborne precautions. 4. Monitor the child for signs and symptoms of dehydration. 5. Initiate an intake and output record. The correct answers are 1, 2, 4, and 5. Shigella is caused by the Shigella organism. Clinical manifestations of Shigella include fever, nausea, and vomiting, some cramping, headache, seizures, rectal prolapse, and loose, watery stools containing pus, mucus, and blood. The nurse should assess the child for these symptoms on an ongoing basis. Shigella is spread via direct contact with the organism, which is found in the stool. A stool specimen will show increased numbers of WBCs, blood, and mucus. Vomiting and loose stools can result in severe dehydration and electrolyte imbalance. Thus, the nurse should record intake, output, and daily weights. There is no need for strict isolation. Masks are not needed, as Shigella is not transmitted by airborne methods. A nasogastric tube inserted during surgery to correct an infant's intussusception is no longer freely removing gastric secretions. Which of the following should the nurse do next? 1. Aspirate the tube with a syringe. 2. Irrigate the tube with distilled water. 3. Increase the level of suction. 4. Rotate the tube. The correct answer is 1. The first action is to check the placement of the tube to ensure that it is in the correct position. To check tube position, the nurse should aspirate the tube with a syringe. A return of gastric contents indicates that the end of the tube is in the stomach. Another method is to inject a small amount of air while auscultating with a stethoscope over the epigastric area. The tube is irrigated with normal saline, not distilled water, and only after the position of the tube is confirmed. The suction level should not be increased, because doing so could damage the mucosa. Rotating the tube could irritate or traumatize the nasal mucosa. A client is to take 1 daily dose of ranitidine at home to treat a peptic ulcer. The client understands proper drug administration of ranitidine when the client will take the drug at which of the following times? 1. Before meals. 2. With meals. 3. At bedtime. 4. When pain occurs. The correct answer is 3. Ranitidine blocks secretion of hydrochloric acid. Clients who take only 1 daily dose of ranitidine are usually advised to take it at bedtime to inhibit nocturnal secretion of acid. Clients who take the drug twice a day are advised to take in the morning and at bedtime. It is not necessary to take the drug before meals. The client should take the drug regularly, not just when pain occurs. Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross-multiply and get 250x equals to 1500. You divide by 250 on both sides, and you get 6 milliliters. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The client in the early stage of Alzheimer's disease and his adult son attend an appointment at the community mental health center. While conversing with a nurse, the son states, "I'm tired of hearing about how things were 30 years ago. Why does Dad always talk about the past?" The nurse should tell the son, 1. Your dad lost his short-term memory, but he still has his long-term memory. 2. You need to be more accepting of your dad's behavior. 3. I want you to understand your dad's level of anxiety. 4. Telling your dad that you are tired of hearing about the past will help him stop. The correct answer is 1. The son's statements regarding his father's recalling past events is typical for family members of clients in the early stage of Alzheimer's disease, when recent memory is impaired. Telling the son to be more accepting is critical and not an attempt to educate. Understanding the client's level of anxiety is unrelated to memory loss of Alzheimer's disease. The client cannot stop reminiscing at will. A nurse notices repetitive late decelerations on the fetal heart monitor. The best initial actions by the nurse include 1. Prepare for birth, reposition patient, and begin pushing. 2. Perform sterile vaginal exam. Increase IV fluids and apply oxygen. 3. Notify the provider. Explain findings to the patient and begin pushing. 4. Reposition patient, apply oxygen, and increase IV fluids. The correct answer is 4. Late decelerations on a fetal heart monitor indicate uteroplacental insufficiency. Interventions to improve perfusion include repositioning the patient, oxygen, and IV fluids. A sterile vaginal exam is not indicated at this time. Late decelerations are not expected findings and do not indicate an imminent birth. The primary healthcare provider plans to perform an amniotomy on a multiparous client admitted to the labor area at 41 weeks gestation for labor induction. After the amniotomy, the nurse should first 1. Monitor the client's contraction pattern. 2. Assess the fetal heart rate for 1 full minute. 3. Assess the client's temperature and pulse. 4. Document the color of the amniotic fluid. The correct answer is 2. After an amniotomy, the nurse should plan to first assess the FHR for 1 full minute. One of the complications of amniotomy is cord compression or prolapsed cord, and an FHR of 100 BPM or less should be promptly reported to the primary healthcare provider. A cord prolapse requires prompt birth by cesarean section. The client's contraction pattern should be monitored once labor has been established. The client's temperature, pulse, and respiration should be assessed every 2 to 4 hours after rupture of the membranes to detect an infection. The nurse should document the color, quantity, and odor of the amniotic fluid, but this can be done after the FHR is assessed and a normal pattern is present. The nurse teaches the father of an infant hospitalized with gastroenteritis about the next step of the treatment plan once the infant's condition has been controlled. The nurse determines that the father understands when he explains which of the following will occur with his infant. 1. The infant will receive clear liquids for a period of time. 2. Formula and juice will be offered. 3. Blood will be drawn daily to test for anemia. 4. The infant will be allowed to go to the playroom. The correct answer is 1. The usual way to treat an infant hospitalized with gastroenteritis is to keep the infant nothing by mouth status to rest the gastrointestinal tract. The resulting fluid volume deficit is treated with intravenous fluids. When the infant's condition is controlled, clear liquids are then started slowly. Formula and juice will be started once the infant's vomiting has subsided and the infant has demonstrated the ability to tolerate clear liquids for a period of time. In this situation, there is no need to test the infant's blood every day for anemia. Most likely, The infant serum electrolyte levels will be monitored closely. Typically, an infant is placed in a private room because gastroenteritis is most commonly caused by a virus that is easily transmitted to others. A male adolescent who underwent repair of an inguinal hernia earlier today and is getting ready to go home receives instructions about resuming physical activities. Which of the following statements would indicate that he has understood the instructions? 1. I can start riding my bike next week. 2. I have to skip physical education classes for 2 weeks. 3. I can start wrestling again in 3 weeks. 4. I can return to my weightlifting class in 2 weeks. The correct answer is 3. Because of possible stress on the suture line, physical activities such as bicycle riding, physical education classes, weightlifting, and wrestling are contraindicated for about 3 weeks. After a subtotal gastrectomy, the nasogastric tube drainage will be what color for about 12 to 24 hours after surgery? 1. Dark brown. 2. Bile green. 3. Bright red. 4. Cloudy white. The correct answer is 1. About 12 to 24 hours after a subtotal gastrectomy, gastric drainage is normally brown, which indicates digested blood. Bile green or cloudy white drainage is not expected during the first 12 to 24 hours after a subtotal gastrectomy. Drainage during the first 6 to 12 hours contains some bright red blood, but large amounts of blood or excessive bloody drainage should be reported to the physician promptly. The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair fractured jaw. The correct order is 3, 4, 2, and 1. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with a fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. The nurse is making a home visit with a client diagnosed with Alzheimer's disease. The client recently started on lorazepam due to increased anxiety. The nurse is cautioning the family about the use of lorazepam. The nurse should instruct the family to report which of the following significant side effects to the healthcare provider? 1. Paradoxical excitement. 2. Headache. 3. Slowing of reflexes. 4. Fatigue. The correct answer is 1. Although all the side effects listed are possible with lorazepam, paradoxical excitement is cause for immediate discontinuation of the medication. Paradoxical excitement is the opposite reaction to lorazepam than is expected. The other side effects tend to be minor and usually are transient. A client with dementia who prefers to stay in his room has been brought to the day room. After 10 minutes, the client becomes agitated and retreats to his room again. The nurse decides to assess the conditions in the day room. Which is the most likely occurrence that is disturbing to this client? 1. There is only one other client in the day room. The rest are in a group session in another room. 2. There are 3 staff members and 1 primary healthcare provider in the nurse's station working on charting. 3. A relaxation tape is playing in one corner of the room, and a television airing a special on crime is playing in the opposite corner. 4. A housekeeping staff member is washing off the countertops in the kitchen, which is on the far side of the day room. The correct answer is 3. The tape and television are competing. Even conflicting stimuli, crime events portrayed on television, could be misperceived as a real threat to the client. A low number of clients in the presence of a few staff members quietly working are less intense stimuli for the client and not likely to be disturbing. The primary health care provider determines that the fetus of a multiparous client in active labor is in distress, necessitating a cesarean birth with general anesthesia. Before the cesarean birth, the anesthesiologist prescribes cimetidine 300 milligrams PO. After administering the drug, the nurse should assess the client for reduction in which of the following? 1. Incidence of bronchospasm. 2. Oral and respiratory secretions. 3. Acid level of the stomach contents. 4. Incidence of postoperative gastric ulcer. The correct answer is 3. Cimetidine is prescribed by some anesthesiologists who will be giving a general anesthetic to reduce the level of acid in the stomach contents, altering the pH to reduce the risk of complications should aspiration of vomitus occur. Aspiration of vomitus is the 5th most common cause of maternal mortality. Most anesthesiologists insert an endotracheal tube to reduce the incidence of aspiration. Isoproterenol is used to decrease the incidence of bronchospasm. Atropine sulfate is administered to dry oral and nasal secretions. Although cimetidine is useful for gastric ulcer therapy, gastric ulcers are not a common effect associated with operative births. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The mother of a toddler hospitalized for episodes of diarrhea reports that when her toddler cannot have things the way she wants, she throws her legs and arms around, screams, and cries. The mother says, "I don't know what to do." After teaching the mother about ways to manage this behavior, which of the following statements indicates that the nurse's teaching was successful? 1. Next time she screams and throws her legs, I'll ignore the behavior. 2. I'll allow her to have what she wants once in a while. 3. I'll explain why she cannot have what she wants. 4. When she behaves like this, I'll tell her that she's being a bad girl. The correct answer is 1. The child is demonstrating behavior associated with temper tantrums, which are relatively frequent normal occurrences during toddlerhood as the child attempts to develop a sense of autonomy. The development of autonomy requires opportunities for the child to make decisions and express individuality. Ignoring the outbursts is probably the best strategy. Doing so avoids rewarding the behavior and helps the child to learn limits, promoting the development of self-control. However, the mother should intervene in a temper tantrum if the child is likely to injure herself. Allowing the child to have what she wants occasionally would typically add to problems associated with temper tantrums, because doing so rewards behavior and prevents the child from developing self-control. Toddlers do not possess a capacity to understand explanations about behavior. Expressing disappointment in the child's behavior or telling her that she is being a bad girl reinforces feelings of guilt and shame, thus interfering with the child's ability to develop a sense of autonomy. A nurse is caring for a 10-month-old, weighing 8.0 kilograms, who was admitted for dehydration. The infant has vomited 5 times in the last 3 hours and has had no wet diapers in the last 8 hours. The nurse informs the primary healthcare provider, which of the following prescriptions should the nurse question? 1. Begin an intravenous line of D5W.45% normal saline at 40 milliliters per hour. 2. NPO except for medication administration while vomiting persists. 3. Begin an intravenous line and administer a fluid bolus of dextrose 25%. 4. Strict intake and output, weighing all diapers. The correct answer is 3. The infant is in need of a fluid bolus. A fluid bolus should consist of an isotonic fluid, such as normal saline or lactated ringers. Dextrose 25% is not an appropriate bolus for dehydrated children because it could cause a fluid shift that may result in cerebral edema and death. D5.45% normal saline is an appropriate IV fluid for infants. The rate is 1.5 times maintenance for this child and is appropriate for the first 24 hours if the child is dehydrated. Once hydration is adequate, the infant's IV rate should be reduced to a maintenance rate. Vomiting is persistent, so it is appropriate for the child to be NPO. Strict INO is an appropriate prescription for all dehydrated children. When assessing a 4-month-old infant diagnosed with possible intussusception, the nurse should expect a mother to relate which of the following about the infant's crying and episodes of pain. 1. Constant accompanied by leg extension. 2. Intermittent with knees drawn to the chest. 3. Shrill during ingestion of solids. 4. Intermittent while being held in the mother's arms. The correct answer is 2. The infant with intussusception experiences acute episodes of colic-like abdominal pain. Typically, the infant screams and draws the knees to the chest. Between these episodes of acute abdominal pain, the infant appears comfortable and normal. Feeding does not precipitate episodes of pain. Additionally, a 4-month-old infant typically would not be ingesting solid foods. Pain exhibited by crying that occurs when the infant is placed in a reclining position, as in the mother's arms, is not associated with intussusception. This type of cry may indicate that the infant wants attention, wants to be held, or needs to have a diaper change. The nurse finds a client who has been diagnosed with a peptic ulcer surrounded by papers from a briefcase and arguing on the telephone with a co-worker. The nurse's response to observing these actions should be based on knowledge that 1. Involvement with the job will keep the client from becoming bored. 2. A relaxed environment will promote ulcer healing. 3. Not keeping up with the job will increase the client's stress level. 4. Setting limits on the client's behavior is an important nursing responsibility. The correct answer is 2. A relaxed environment is an essential component of ulcer healing. Nurses can help clients understand the importance of relaxation and explore with them ways to balance work and family demands to promote healing. Being involved with his work may prevent boredom. However, this client is upset and argumentative. Not keeping up with his job will probably increase the client's stress level, but the nurse's response is best if it is based on the fact that a relaxed environment is an essential component of ulcer healing. Nurses cannot set limits on a client's behavior. Clients must make the decision to make lifestyle changes. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Clients with stomatitis have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing. While educating the daughter of a client with dementia about the illness, the daughter mentions to the nurse that her mother distorts things. The nurse understands that the daughter needs further teaching about dementia when she makes which statement? 1. I tell her reality, such as, that noise is the wind in the trees. 2. I understand the misperceptions are part of the disease. 3. I turn off the radio when we're in another room. 4. I tell her she is wrong, and then I tell her what's right. The correct answer is 4. Telling the client that she is wrong, and then telling her what is right is argumentative and challenging. Arguing with or challenging distortions is least effective because it increases defensiveness. Telling the client about reality indicates awareness of the issues and is appropriate. Acknowledging that misperceptions are part of the disease indicates an understanding of the disease and an awareness of the issues. Turning off the radio helps to limit environmental stimuli and indicates an awareness of the issues. Following an epidural and placement of internal monitors, a client's labor is augmented. Contractions are lasting greater than 90 seconds and occurring every 1.5 minutes. The uterine resting tone is greater than 20 with an abnormal fetal heart rate and pattern. Which of the following actions should the nurse take first? 1. Notify the healthcare provider. 2. Turn off the oxytocin infusion. 3. Turn the client to her left side. 4. Increase the maintenance IV fluids. The correct answer is 2. The client is experiencing uterine hyperstimulation from the oxytocin. The first intervention should be to stop the oxytocin infusion, which may be the cause of the long, frequent contractions, elevated resting tone, and abnormal fetal heart patterns. Only after turning off the oxytocin should the nurse turn the client to her left side to better perfuse the mother and fetus. Then she should increase the maintenance IV fluids to allow available oxygen to be carried to the mother and fetus. When all other interventions are initiated, she should notify the healthcare provider. Approximately 15 minutes after birth of a viable term neonate, a multiparous client has chills. Which of the following should the nurse do next? 1. Assess the client's pulse rate. 2. Decrease the rate of intravenous fluids. 3. Provide the client with a warm blanket. 4. Assess the amount of blood loss. The correct answer is 3. A chill shortly after birth is a common, normal occurrence. Warm blankets can help provide comfort for client. It has been suggested that the shivering response is caused by a difference between internal and external body temperatures. A different theory proposes that the woman is reacting to fetal cells that have entered the maternal bloodstream through the placental site. Assessing the client's pulse rate will provide no further information about the chill. Decreasing the IV rate will not influence the length of time the client trembles. Assessing blood loss is a standard of care at this point postpartum, but has no correlation to the chill. Which of the following would be appropriate for the nurse to identify as a priority nursing problem for an infant just admitted to the hospital with a diagnosis of gastroenteritis? 1. Pain related to repeated episodes of vomiting. 2. Deficient fluid volume related to excessive losses from severe diarrhea. 3. Impaired parenting related to infant's loss of fluid. 4. Impaired urinary elimination related to increased fluid intake feeding pattern. The correct answer is 2. Given this infant's history of gastroenteritis, the priority problem would be fluid volume deficit. With gastroenteritis, vomiting and diarrhea occur, leading to the loss of fluids. This loss of fluids is problematic in infants because a higher proportion of their body weight is water. Pain is not a priority problem, although the nurse should continue to assess the infant for pain. There are no data to indicate impaired parenting. Impaired urinary elimination is related to the infant's fluid volume deficit resulting from vomiting and diarrhea associated with gastroenteritis. If the infant's fluid volume deficit is not corrected, then this nursing diagnosis may become the priority. A mother asks, "How should I bathe my baby now that he's had surgery for his inguinal hernia?" Which of the following instructions should the nurse give the mother? 1. Clean his face and diaper area for 2 weeks. 2. Use sterile sponges to cleanse the inguinal incision. 3. Give him a sponge bath daily for 1 week. 4. Give the infant full tub baths every day. The correct answer is 3. The incision must be kept as clean and dry as possible. Therefore, daily sponge baths are given for about 1 week postoperatively. Cleaning the infant's face and diaper area should occur at least daily and continuously, not limited to a 2-week period. Because this type of surgery results in a wound that heals through primary intention, the skin will heal and cover the wound in 2 to 3 days. Therefore, it is not necessary to use sterile gauze to cleanse the incision. Clean technique is acceptable because the incision must be kept as clean and dry. Full tub baths are inappropriate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. Since the diagnosis of stomach cancer, the client has been having trouble sleeping and is frequently preoccupied with thoughts about how life will change. The client says, "I wish my life could stay the same." Based on this information, the nurse should understand that the client, 1, is having difficulty coping, 2, has a sleep disorder, 3, is grieving, 4, is anxious. The correct answer is 3. The information presented indicates the client is grieving about the changes that will occur as a result of the diagnosis of gastric cancer. The information does not indicate the client is having difficulty coping or experiencing insomnia. The client is not demonstrating signs of anxiety. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters. The primary healthcare provider prescribes risperidone for a client with Alzheimer's disease. The nurse anticipates administering this medication to help decrease which of the following behaviors? 1. Sleep disturbances. 2. Concomitant depression. 3. Agitation and assaultiveness. 4. Confusion and withdrawal. The correct answer is 3. Antipsychotics are most effective with agitation and assaultiveness. Antipsychotics have little effect on sleep disturbances, concomitant depression, or confusion and withdrawal. A client diagnosed with dementia wanders the halls of the locked nursing unit during the day. To ensure the client's safety while walking the halls, the nurse should do which of the following? 1. Administer PRN haloperidol to decrease the need to walk. 2. Assess the client's gait for steadiness. 3. Restrain the client in a geriatric chair. 4. Administer PRN lorazepam to provide sedation. The correct answer is 2. Elderly clients have increased risk for falls due to balance problems, medication use, and decreased eyesight. Haldol may cause extrapyramidal side effects, which increase the risk for falls. The client is not agitated, so restraints are not indicated. Lorazepam may increase fall risk and cause paradoxical excitement. When developing the plan of care for a multiparous client in active labor who receives an epidural anesthetic, which of the following would the nurse anticipate that the primary healthcare provider will prescribe if the client develops moderate hypotension? 1. Ephedrine. 2. Epinephrine. 3. Methylergonavine. 4. Atropine sulfate. The correct answer is 1. The drug of choice when hypotension occurs as a result of epidural anesthesia is ephedrine sulfate because it provides a quick reversal of the vasodilator effects of the anesthesia. Epinephrine is typically used to treat anaphylactic shock. Methylergonavine is a vasoconstrictor that is used for severe postpartum hemorrhage. Atropine sulfate is used to dry the oral and respiratory secretions and may be used during operative procedures. On a home visit following discharge from the hospital after treatment for severe gastroenteritis, the mother tells the nurse that her toddler answers no and is difficult to manage. After discussing this further with the mother, the nurse explains that the child's behavior is most likely the result of which of the following? 1. Beginning leadership skills. 2. Inherited personality trait. 3. Expression of individuality. 4. Usual lack of interest in everything. The correct answer is 3. The no behavior demonstrated by a toddler is typical of this age group as the child attempts to be self-assertive as an individual. The negativism does not demonstrate an inherited personality trait or disinterest. Rather, it reflects a developmental task of establishing autonomy. The toddler is attempting to exert control over the environment. It is too early to assess leadership qualities in a toddler. An infant with Hirschsprung's disease is to be discharged 1 or 2 days after surgery to create a colostomy. After teaching the infant's parents about the overall effects of their infant's surgery, the nurse determines that the teaching has been effective when the parents state which of the following? 1. His abdomen will be large for a while. 2. When he's ready, toilet training may be difficult. 3. We need to limit his intake of dairy products. 4. We will give him vitamin supplements until he is an adolescent. The correct answer is 2. Toilet training is commonly more difficult for children who have undergone surgery for Hirschsprung's disease than it is for other children. This is because of the trauma to the area and the associated psychological implications. Abdominal distension is an early sign of infection, and therefore the parents need to report it to the primary care provider. Typically, dietary restrictions are not required. Usually, the infant is placed on an age-appropriate diet. Vitamin supplementation is not necessary if the infant's dietary intake is adequate. 1 month following a subdural gastrectomy for cancer, the nurse is evaluating the nursing care goal related to nutrition. Which of the following indicates that the client has attained the goal? The client has 1. Regain weight loss. 2. Resume normal dietary intake of 3 meals a day. 3. Control nausea and vomiting through regular use of antiemetics. 4. Achieved optimal nutritional status through oral or parenteral feedings. The correct answer is 4. An appropriate expected outcome is for the client to achieve optimal nutritional status through the use of oral feedings or total parenteral nutrition. TPN may be used to supplement oral intake, or may be used alone if the client cannot tolerate oral feedings. The client would not be expected to regain lost weight within 1 month after surgery or to tolerate a normal dietary intake of 3 meals a day. Nausea and vomiting would not be considered an expected outcome of gastric surgery, and regular use of antiemetics would not be anticipated. The nurse is preparing to teach a client with a peptic ulcer about the diet that should be followed after discharge. The nurse should explain that the client should eat which of the following? 1. Bland foods. 2. High protein foods. 3. Any foods that are tolerated. 4. A glass of milk with each meal. The correct answer is 3. Diet therapy for ulcer disease is a controversial issue. There is no scientific evidence that diet therapy promotes healing. Most clients are instructed to follow a diet that they can tolerate. There is no need for the client to ingest only a bland or high-protein diet. Milk may be included in the diet, but it is not recommended in excessive amounts. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse discusses the possibility of a client's attending day treatment for clients with early Alzheimer's disease. Which of the following is the best rationale for encouraging day treatment? 1. The client would have more structure to his day. 2. Staff are excellent in the treatment they offer clients. 3. The client would benefit from increased social interaction. 4. The family would have more time to engage in their daily activities. The correct answer is 3. The best rationale for day treatment for the client with Alzheimer's disease is the enhancement of social interactions, more daily structure, excellent staff, and allowing caregivers more time for themselves are all positive aspects, but they are less focused on the client's needs. A client is induced with oxytocin. The fetal heart rate is showing accelerations lasting 15 seconds and exceeding the baseline with fetal movement. What action associated with this finding should the nurse take? 1. Turn the client to her left side. 2. Administer oxygen via face mask at 10 to 12 liters a minute. 3. Notify the healthcare provider of the situation. 4. Document fetal well-being. The correct answer is 4. Accelerations are episodic and occur during fetal movement, demonstrate fetal well-being. Turning the client to the left side, applying oxygen by face mask, and notifying a healthcare provider are interventions used for late and variable decelerations indicating the fetus is not tolerating the induction process well. A multigravida client who is 10 centimeters dilated is admitted to the labor and birth unit. In addition to supporting the client, priority nursing care includes 1. Turning on the infant warmer. 2. Increasing IV fluids. 3. Determining the client's preferences for pain control. 4. Providing client education regarding care of a newborn. The correct answer is 1. Nursing care for this client includes providing support, preparing for childbirth, assessing for potential complications, and providing for care of a newborn. Turning on the warmer is the best choice for providing for the care of the newborn. Oxygen and IV fluids may be indicated if variable or late decelerations are noted on the fetal heart monitor, but decelerations are not indicated in the question. It is likely too late for pharmacologic pain relief for a multigravida client. Education regarding care of a newborn is not appropriate at this time. The mother of a toddler who has just been admitted with severe dehydration secondary to gastroenteritis says that she cannot stay with her child because she has to take care of her other children at home. Which of the responses by the nurse would be most appropriate? 1. You really shouldn't leave right now. Your child is very sick. 2. I understand, but feel free to visit or call anytime to see how your child is doing. 3. It really isn't necessary to stay with your child. We'll take very good care of him. 4. Can you find someone to stay with your children? Your child needs you here. The correct answer is 2. The nurse's best course of action would be to support the mother. This is best done by conveying understanding and encouraging the mother to visit or call. Telling the mother that she shouldn't leave and that the child is very sick is critical and insensitive. Additionally, it implies guilt should the mother leave. Commenting that the child does not need anyone is not appropriate or true. Toddlers, in particular, need family members present because of the stresses associated with hospitalization. They experience separation anxiety, a normal aspect of development, and need constancy in their environment. Asking the mother to find someone else to stay with her children is inappropriate. The children at home also need the support of the mother and or other family members to minimize the disruptions in family life resulting from the toddler's hospitalization and to maintain consistency. During physical assessment of a 4-month-old infant with Hirschsprung's disease, the nurse should most likely note which of the following? 1. Scaphoid-shaped abdomen. 2. Weight less than expected for height and age. 3. Cyanosis of the fingers and toes. 4. Hyperactive deep tendon reflexes. The correct answer is 2. Infants with Hirschsprung's disease typically display failure to thrive, with poor weight gain due to malabsorption of nutrients. Therefore, the nurse would expect to see a child who weighs less than that which is expected for height and age. A distended, rather than a scaphoid-shaped, abdomen would be noted. Cyanosis of fingers and toes is associated with congenital heart disease. Hyperactive deep tendon reflexes are associated with upper motor neuron problems, such as cerebral palsy. A client has a nasogastric tube following a subdural gastrectomy. The nurse should 1. Irrigate the tube with 30 milliliters of sterile water every hour if needed. 2. Reposition the tube if it is not draining well. 3. Monitor the client for nausea, vomiting, and abdominal distension. 4. Turn the machine to high suction if the drainage is sluggish on low suction. The correct answer is 3. Nausea, vomiting, or abdominal distension indicates that gas and secretions are accumulating within the gastric pouch due to impaired peristalsis or edema at the operative site and may indicate that the drainage system is not working properly. Saline solution is used to irrigate NG tubes. Hypotonic solutions, such as water, increase electrolyte loss. In addition, a physician's prescription is needed to irrigate the NG tube because this procedure could disrupt the suture line. After gastric surgery, only the surgeon repositions the NG tube because of the danger of rupturing or dislodging the suture line. The amount of suction varies with the type of tube used and is prescribed by the physician. High suction may create too much tension on the gastric suture line. The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, The UAP reports the client, who was previously afebrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid bore-like abdomen, and developing signs of shock. Telling the assistant to change thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing by mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate. When providing family education for those who have a relative with Alzheimer's disease about minimizing stress, which of the following suggestions is most relevant? 1. Allow the client to go to bed 4 to 5 times during the day. 2. Test the cognitive functioning of the client several times a day. 3. Provide reality orientation, even if the memory loss is severe. 4. Maintain consistency in environment, routine, and caregivers. The correct answer is 4. Change increases stress. Therefore, the most important and relevant suggestion is to maintain consistency in the client's environment, routine, and caregivers. Although rest periods are important, going to bed interferes with the sleep-wake cycle. Rest in a recliner chair is more useful. Testing cognitive functioning and reality orientation are not likely to be successful and may increase stress if memory loss is severe. Nursing staff are trying to provide for the safety of an elderly female client with moderate dementia. She is wandering at night and has trouble keeping her balance. She has fallen twice but has had no resulting injuries. The nurse should 1. Move the client to a room near the nurse's station and install a bed alarm. 2. Have the client sleep in a reclining chair across from the nurse's station. 3. Help the client to bed and raise all 4 bed rails. 4. Ask a family member to stay with the client at night. The correct answer is 1. Using a bed alarm enables the staff to respond immediately if the client tries to get out of bed. Sleeping in a chair at the nurse's station interferes with the client's restful sleep and privacy. Using all 4 bed rails is considered restraint and unsafe practice. It is not appropriate to expect a family member to stay all night with the client. The nurse prepares a client for lumbar epidural anesthesia. Before anesthesia administration, the nurse instructs the client to assume which of the following positions? 1. Lithotomy. 2. Side lying. 3. Knee to chest. 4. Prone. The correct answer is 2. Lumbar epidural anesthesia is usually administered with a client in a sitting or a left side lying position with shoulders parallel and legs slightly flexed. These positions expose the vertebrae to the anesthesiologist. Paracervical and local anesthetics are usually administered with the client in a lithotomy position. The knee to chest and prone positions are not used for anesthesia administration. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The mother of a toilet-trained toddler who was admitted to hospital for severe gastroenteritis and subsequent dehydration, and is now at home asks the nurse why the child still wets the bed. Which of the following should be the nurse's best response? 1. Hospitalization is a traumatic experience for children. Regression is common, and it takes time for them to return to their former behavior. 2. The stress of hospitalization is hard for many children, but usually they have no problems when they return home. 3. After returning home from being hospitalized, children still feel they should be the center of attention. 4. Children do not feel comfortable in their home surroundings once they return home from being hospitalized. The correct answer is 1. Hospitalization is a traumatic time for a child, and it takes some time to readjust to the home environment. The child may regress at home for a period until she feels comfortable. Children normally do not dislike their home environment. In fact, they usually are eager to get home to familiar surroundings where they feel safe. A mother brings her 3-month-old child into the emergency department. The child is listless with dry mucous membranes, tending of the skin on the forehead, a depressed fontanelle, and a history of vomiting and diarrhea for the last 36 hours. In what order from first to last should the nurse implement the primary care provider prescriptions? 1. Obtain vital signs and wait. 2. Insert an IV and infuse fluids. 3. Apply a urine collection bag. 4. Draw blood for laboratory tests. The correct order is 1, 3, 2, and 4. The nurse should first obtain vital signs and evaluate the child for signs of shock or cardiac arrhythmias. The weight can also be obtained at this time to estimate the amount of fluid lost. The nurse should next apply the urine collection bag. As soon as possible after these steps, the nurse should insert an IV to replace lost fluids, electrolytes, and sugar to reduce the incidence of metabolic acidosis created by the lack of calorie intake and the loss of electrolytes. Blood should be drawn to assess the severity of electrolyte imbalance and other possible causes for the diarrhea and vomiting. When obtaining the nursing history from the mother of an infant with suspected intussusception, which of the following questions would be most helpful? 1. What do the stools look like? 2. When was the last time your child urinated? 3. Is your child eating normally? 4. Has your child had any episodes of vomiting? The correct answer is 1. For the infant with intussusception, stools characteristically have the appearance of currant jelly because of the intestinal inflammation and hemorrhage resulting from intestinal obstruction. These stools occur later in the course of the disease process. Questions that focus on urination, vomiting, and food intake do not elicit information about the effects of intussusception. A client with a peptic ulcer has been instructed to avoid intense physical activity and stress. Which strategy should the client incorporate into the home care plan? 1. Conduct physical activity in the morning in order to be able to rest in the afternoon. 2. Have the family agree to perform the necessary yard work at home. 3. Give up jogging and substitute a less demanding hobby. 4. Incorporate periods of physical and mental rest in the daily schedule. The correct answer is 4. It would be most effective for the client to develop a health maintenance plan that incorporates regular periods of physical and mental rest in the daily schedule. Strategies should be identified to deal with the types of physical and mental stressors that the client needs to cope in the home and work environments. Scheduling physical activity to occur only in the morning would not be restful or practical. There is no need for the client to avoid yard work or jogging if these activities are not stressful. A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.